on this first day of spring. Although I'm sure everyone woke up this morning and saw the snow, we still felt that it was not spring yet. But anyway, thank you for joining us today. We look forward in terms of the participation, particularly of our panel that we have this morning. First, I would like to say that this meeting of the Illinois Advisory Committee to the U.S. Commission on Civil Rights shall come to order. For the benefit of those in the audience, I shall introduce myself, as well as in terms of the colleagues will introduce themselves individually. My name is Barbara Abrahano, and I am the chair of the Illinois Advisory Committee for the U.S. Commission on Civil Rights. And now I would like to start with Gordon Quinn.
Hi, I'm Gordon Quinn. I'm the artistic director and founder of Cartemquin Films. We make documentaries about all kinds of social issues.
Good morning, Malik Nevels. I'm the executive director for the Illinois African American Coalition for Prevention.
Good morning. My name is Darlene Oliver. I'm the executive director for Public Allies Chicago.
I'm William Howard, professor of English at Chicago State University.
Thank you. And I'm sure that there will be other members of the advisory committee joining us as we go through today. I would also like to introduce you to David Musat, who is our regional director, and Carolyn Allen, who is the administrative assistant. Well, when Carolyn comes back, we'll reintroduce her. And also present today is the general counsel, Rory Smith. Rory? Oh, yes. And now I would have with great pleasure also would like to introduce you to Marty Castro, who is the chair of the U.S. Commission on Civil Rights in Washington. Marty, can you come to the podium and say a few words?
Thank you, Madam Chair. It's great to be back here with my former colleagues from the Illinois State Advisory Committee to the U.S. Commission on Civil Rights. This is where my relationship with the Commission got started in 2003, and I'm very pleased to be here once again to address the topic that you are addressing, to hear about the really important work you're doing on the issue of food deserts. And it's a project that we began to work on when I was chair. And I'm glad to see that the report that you all finished after the President sent me to Washington has been a very important and impactful report. Because what you did in talking about the issue of food deserts as a civil rights issue was groundbreaking. If you go to Google, which many of us do on so many issues, and you Google food deserts and civil rights, the first thing that comes up is the report from this State Advisory Committee. And that is the main subject information that is cited by others. We all know that the issue of food security affects people around the world, in different parts of the world. It is a human right. But here in the United States, it has not yet been formally established as a civil right. And the work that you are doing at the State Advisory Committee and the information that's been garnered from experts such as those here today and those that testified before this committee in 2010 are leading the way to make food security, and as some of your former witnesses have testified, food deserts is maybe not even the appropriate term. Food apartheid is one of the terms that has been used, but certainly food security. And that is not an issue that we've addressed yet at the federal level. So the work that you're doing is going to do much to inform us in Washington, D.C. So I want to thank you for your continued work. Thank the members of the committee for your continued service, not only to the people of Illinois, but to the people of the United States in this important position that you hold. And I want to thank and congratulate Chair Alvarado on all the work that she's been doing and the leadership that she's given to this committee after I went to Washington. I know you're working on several projects simultaneously, including prisoners' rights, obviously food security and food deserts and other health-related issues, but also the issue of immigration. So keep up the great work. Thank you.
on behalf of the committee again, I would like to thank Marty Castro for spearheading this project and for the many meetings and conferences and phone calls that took place to make this happen. So thank you again. Before we start, also, I'd like to introduce another member of the committee who has, two members of the committee who have arrived. So if you could please introduce yourself.
Hi, I'm Betsy Schumann Moore, and I'm with the Chicago Lawyers Committee for Civil Rights, Hate Crime, and Fair Housing Projects.
Good morning. My name is Farhan Yunus. I'm an attorney and also a member of the Council of Islamic Organizations of Greater Chicago.
Thank you. And before we get started with the panel, I would like to just make a few remarks. The U.S. Commission on Civil Rights is an independent bipartisan agency of the federal government charged with studying discrimination or denial and equal protection of the laws because of race, color, religion, sex, age, disability, or national origin, or in the administration of justice. In each of the 50 states, an advisory committee to the commission has been established, and they are made up of responsible persons who serve without compensation to advise the commission on relevant information concerning their respective state. Today, our purpose is to have a panel discussion to assess how the various initiatives to address Chicago's food deserts are performing. We will hear the initiatives of leaders from corporations, government, and nonprofits. We are fortunate and thankful to have such a balanced and diverse panel. At the outset, I want to remind everyone present on the ground rules. This is a public meeting, open to the media and the general public. The Federal Advisory Committee Act also requires that we allow a period for public comment. Therefore, we have scheduled an open session today at 12:45 p.m. for that purpose. Anyone wishing to make a statement during that period should contact David Roussac or other commission staff to have their name placed on the list. In addition, written statements may be submitted to committee members or staff present here today. The record for this meeting will close on April 19, 2014. Though some of the statements made today may be controversial, we want to ensure that all invited guests do not defame or degrade any person or any organization. As the chair, I reserve the privilege to cut short any statements that defame, degrade, or do not pertain to the issue at hand. Any person or any organization that feels defamed or degraded by statements made in these proceedings should contact our staff during the meeting so that we can provide a chance for public response. Alternatively, such persons or organizations can file written statements for inclusion in the proceedings. I now, in terms of, will turn over the meeting to Malik Nevels, who will moderate today's conversation. Thank you.
Good morning. In August of 2010, the State Advisory Committee for the U.S. Commission on Civil Rights convened a fact-finding meeting to examine the issue of limited healthy food access in Chicago. In 2011, as a follow-up to this expert testimony provided at the meeting, the Commission issued its Food Deserts in Chicago report. For the edification of those that may not have had the opportunity to read the report in its entirety, what I'd like to do is take a couple of minutes to set the stage for today's panel by reviewing some of the key findings and recommendations from this report. One of the first findings is that food deserts in Chicago must be addressed as a civil rights issue. Food deserts are a public health problem throughout Illinois. Neighborhoods and communities in both urban and rural areas can experience limited access to fresh, nutritious fruits and vegetables. However, the committee finds that the issue of food deserts in Chicago should be a civil rights issue. Food deserts exist almost exclusively in African-American neighborhoods within the city. Furthermore, but for family food retailers present in Latino communities, food deserts would also exist in many of these communities as well. The second finding and recommendation was the need to define food deserts or find a new description of the problem. The term food desert does not define accurately the problem neighborhoods face. Based upon the obesity epidemic in communities of color, scarcity of food is not the problem. The problem is providing increased access to healthy, nutritious fruits and vegetables at a reasonable cost. The committee recommends that the USDA define food desert will offer a new term with a clear definition of this problem of access to healthy, nutritious foods. The third finding and recommendation, recognize diversity of communities. In Chicago, food deserts predominate in African American communities, but they also exist in Latino communities. There are great challenges within African American and Latino communities themselves, and each neighborhood has its own variations with respect to access to public transportation, rates of car ownership, crime, number of fast food options present, availability of vacant land, zoning restrictions, quality of existing stores, and many other specific factors. The committee concludes that seeking one cure for all or a one-size-fits-all approach to addressing the food desert problem is futile. Solutions must be derived by community while considering all of these and other relevant factors. Third, expand focus beyond solely opening new stores. The committee heard numerous presenters state that simply opening grocery stores is not the sole goal and will not solve the problem. The committee finds that efforts to address food deserts must also focus on increasing food and nutrition education, understanding cultural traditions, and addressing economic hurdles to healthy eating and living. Fourth, or fifth, improve community involvement. The committee determined that the community must be a primary participant in any effort to address nutritious food access in the neighborhoods. For food retailers to succeed, the neighborhoods in which they are located must support and buy into those stores. Neighborhoods labeled as food deserts struggle in numerous areas, and the residents of these neighborhoods need to determine their own priorities and strategies with the assistance and support of government, nonprofit organizations, food retailers, and other interested parties and potential stakeholders. Last but not least, expand retailer involvement and investment. Just as the committee concludes that the community buy-in is crucial to opening new stores in these neighborhoods, food retailers have an important role to play in aiding in the behavioral changes needed. Retailers must recognize the educational needs, cultural traditions, and economic challenges residents of food deserts face. In addition, retailers should partner with nonprofit organizations and academic institutions as frequently as possible to aid efforts in addressing community concerns. So we fast forward 3 years later, and we're here today to learn what progress, if any, has been made to eliminate food deserts in Chicago, and what additional work must be done to secure nutritious and affordable food for all Chicago residents. To assist us in this endeavor, we are joined by a distinguished panel of experts which represent a diverse cross-section of public, private, and nonprofit actors working in or working through systems that ultimately impact access to nutritious and affordable foods. Beginning with my immediate right is Dr. Choucair, or Dr. Bechara, Commissioner for the Chicago Department of Public Health. To his immediate right is Sonya Harper, the Outreach Manager with Growing Home Incorporated. To her right is, mix it up on me, I believe Terri Zoo. No? Okay.
Trinita.
Oh, I'm sorry.
Trinita Logue.
You would step back. Trinita Logue, President of the Illinois Fresh Foods Fund.
Yes, that's fine.
Okay. To her right is Terri Zoo, Program Director for, is it Louis?
Louis, but everyone in the neighborhood says Lewis's.
Lewis's. We'll stick with community tradition, which is good. To her right, I believe, is Connie Spreen, Executive Director for Experimental Station. And to her right is Rafael Malpica, Community Affairs for Walgreens. Please join me in welcoming our distinguished panel. So to begin, what I'd like to do is provide each of the panel members with 5 to 7 minutes to speak about, your organization and the initiatives that it is pursuing to address food deserts in Chicago. And I'd also like to ask that you speak directly into the mic. And we'll begin with Dr. Choucair.
Thank you so much, Malik, for moderating the session. Thank you to the Commission on Civil Rights for hosting this event. Thank you, co-panelists, for joining me here today, and thanks to the audience. So my name is Bechara, Choucair, and I serve as the Commissioner for the Chicago Department of Public Health. And back in August of 2011, when Mayor Emanuel released our Healthy Chicago agenda, which is our public health agenda for the city, one of the key priorities in that agenda was addressing obesity issues, and under that priority was how do we make sure that residents in our communities have access to healthy and affordable food. Obviously, Mayor Emanuel has supported several initiatives to increase access to healthy foods since he became mayor, and we are all familiar with his work with executives from major grocery chains across the country to open new grocery stores in communities across Chicago. So this continues to be a top priority for the mayor. I wanted to highlight a couple of the initiatives that we've worked on in addition to opening, to seeing some of the new stores opening up in our city. We have launched a fresh produce cart initiative, which it will be expanded to 30 carts this year. This is in partnership with Streetwise and Neighbor Capital. Earlier this month, Mayor Emanuel proposed the Healthy Corner Store pilot project, which would provide grant dollars to local retailers for 1 year to expand fresh produce and dairy products in their store. And this pilot provides training, technical assistance, and business resources to corner store owners and operators in the heart of Chicago's food deserts, as well as assistance with the procurement of fresh fruit options. And under the mayor's leadership, the city has supported the installation of school gardens in over 400 schools. Many staff at these schools have been trained so they can start serving produce grown from their gardens and their cafeterias. And most recently, the mayor's used $1 million in NATO legacy funds to support continued expansion of these gardens. We also know that many new farmers markets have been launched on Chicago's west side with SNAP payment availability. Also the city has passed an ordinance making it easier for urban agriculture operators to sell their food. Accompanying the new ordinance is a newer program called Farmers for Chicago, a program designed to provide land and training for urban residents interested in getting into the agriculture business. And about 15 acres of urban land currently operates or is about to break ground. And one of the city's partners, Growing Home, reportedly grew or sold more than 13,000 pounds of organic produce, and I'm assuming my colleague here will mention that. And we'll mention that in more depth in a little bit later. And the city has provided about $750,000 annually in recent years for related programs, including urban beekeeping and distribution of fresh foods in neighborhoods without many grocery stores. There are many more options and opportunities that I'll be happy to chat about during the panel discussion a little bit later. So I'll conclude my opening remarks here.
Thank you.
Good afternoon. Growing Home's mission is to operate, promote, and demonstrate the use of organic agriculture as a tool for community development, job training, and employment. We are a nonprofit social enterprise which uses our farms to provide education and training to individuals with multiple barriers to employment. We have a transitional jobs training program, which is the crux of our mission, to put hard-to-employ people back to work. So we do serve three main purposes. One, putting hard-to-employ people back to work. Two, improving access to food in a community labeled as a food desert. And we also offer our organic produce through our Wednesdays at Wood Street farm stand that takes place every Wednesday at the farm throughout the growing season. Wednesdays at Wood Street is also a time where residents are educated on gardening, healthy eating, living, and a number of other issues related to community development. We do hope to become fully sustainable soon, operating off of our own sales. However, right now, sales only cover about 14% of our total operational costs. We are the first and only certified organic production farm in the city of Chicago, and our farm operates year-round. We specialize in greens, but we do a variety of things: spinach, lettuce, carrots, arugula, collards, mustard, beets, just doing vegetables and herbs. In 2011, we did grow a total of 13,000 pounds of produce. That was between our Wood Street sites and our Sukasa site in back of the yards. And in 2013, we grew 24,000 pounds of produce. When our Honorary Street farm expansion is fully up and operating, we expect to triple that amount, getting even more fresh food into the greater Inglewood neighborhood. The reason that Growing Home even exists in Inglewood today is because we were invited here by LISC and Teamwork Inglewood, who drafted a quality of life plan back in 2005. In that quality of life plan, they named a portion of West Inglewood, specifically near 59th and Wood, the Urban Ag District. And then after that, the city sold Growing Home the land for $1, and that redevelopment agreement for the land set the precedent for other urban farms in Chicago. So along with working on our own specific mission, we do also convene a council around urban agriculture and community development that is looking to help to expand this urban ag district in the Inglewood area to definitely help out with food access and overall development in the community. A little bit more about our outreach in the Inglewood neighborhood. I mentioned our Wednesdays at Wood Street that we have at the farm. It's a time where anyone can come, but especially our residents come to the Wood Street for free farm tours to buy organic produce at a great value. We offer the Double Value SNAP program, thanks to a grant from Wholesome Wave and Experimental Station, our partners. We also do gardening classes, and we definitely encourage residents to take their food access into their own hands by gardening, whether it be by community gardening, backyard gardening, or what have you, or even container gardening if you live in an apartment. We also do cooking demos because we realize that nutrition, that education around nutrition and cooking is what our residents need. We have 2 big open houses where our residents can come and experience all that Growing Home does in just one afternoon. So it has become a popular destination for residents and non-residents alike wanting to see the city's first organic farm. We also see community gardening as a tool for community organizing, as well as beautification and improving food access. So we help groups get their gardens started. We do provide assistance to schools, community groups, and others looking to start their gardens. We do have 2 gardens that we really help out with, the Hermitage Street Community Gardening on 56th and Hermitage, and the Wood Street Community Garden on 61st and Wood. We're also currently working with Providence Inglewood Charter School to get their garden up and growing as well. A little bit more about Growing Home spearheaded GUA, the Greater Inglewood Urban Ag Task Force. This is an organization dedicated to creating avenues for urban agriculture in Inglewood, farming, community gardening, and even food and non-food related businesses. Currently, the Urban Ag and Community Development Coalition consists of about 50 local residents, community leaders, businesses, organizations, and even a few elected officials who care about food access in Greater Inglewood. Some of the successes and challenges that we've had, in 2012, after I was hired, we tripled our yearly farm stand sales due to community organizing efforts in the neighborhood. In 2013, we doubled that. To give you an idea, when I arrived, sales were just at about 800 for the year, and now we're seeing sales for the growing season just at Wood Street Farm Stand at about 6,500. Our open houses have also grown dramatically within the past 2 years as before dozens of people would come, and now on the regularly hundreds of people come. So we're definitely getting the message out, and there definitely is a demand for more services such as the ones that we provide. I think that's it. Yeah.
You're gonna have more time, definitely.
I'll take this one. Is this on? Hi, thank you. I'm Trinita Logue, and I am president of an organization called IFF. It used to be, years ago, it was Illinois Facilities Fund, and now its corporate name is IFF because we're in other states as well as Illinois. But the program I'm here to talk about is the Illinois Fresh Food Fund, so it has similar letters, IFFF. So, the Illinois Fresh Food Fund was created by the General Assembly a few years ago, and it is a loan program. Its purpose is to make loans. IFF, the core organization, is a lender, a community development lender. We were formed 26 years ago in Chicago to make loans and do real estate development in low-income neighborhoods throughout the Chicago metro area and then eventually the state. And initially our work was all commercial, so community health centers, child care centers, shelters, food pantries, office buildings, all what we would think of as commercial space. We later added housing, and primarily in the Chicago suburbs, as poverty was increasing in the suburbs and there wasn't the kind of infrastructure in the suburbs that we've long had in the city around affordable housing. So as I said, we were started to do financing, long-term below-market financing and real estate development and real estate support for nonprofit corporations in low-income neighborhoods. And I left some brochures over here, one about our real estate consulting business and one about our loan business. And they say we serve nonprofit corporations. However, there are two exceptions to that. And one is in affordable housing, because a lot of affordable housing developers are for-profit companies, but they do want to work in low-income neighborhoods. And the other exception is for-profit grocery stores. When we took on the Illinois Fresh Food Fund, we did it agreeing to make these loans and finance for-profit grocery stores in the highest need areas throughout the state. So the material that's out on the table does not talk about this, but this is an exception to the nonprofit rule. There is so much going on in Chicago, and so much going on in Chicago Metro around the growth of food access to so many people who haven't had it before. But I'm sorry to report that we have only made one small loan in Chicago from the Illinois Fresh Food Fund. And I think one of the reasons is that there's been so much activity, and the grocery industry, because this is about essentially full-service grocery stores. The grocery industry is a mature, sophisticated, large industry with lots of components, from big boxes to smaller stores that still may have dozens of locations. And many of them did rally around the food access issue a few years ago, and I think particularly when Rahm Emanuel and Michelle Obama asked them to, that we have been, and they have financing access, or they self-finance their stores, that we have been left to work with communities and potential grocers that are less able to get projects done very quickly. Around the state, however, we've done a great deal more. We've done a store in Waukegan, a store in Harvey. We have a store under evaluation in Rockford, a couple of others in the suburbs, several others in central Illinois, and we've completed 2 in East St. Louis. So the program is working the way it's supposed to be working, but not as much for the benefit of Chicago as we would like. A component of our Illinois Fresh Food Fund lending, and this touches on comments that have already been made, is that any grocer participating in this loan program has to have a community engagement program. And this is because we too realized early on that just opening a grocery store doesn't solve the problem. People need help converting their behavior to healthier choices. People need education about nutrition. People need support. And a lot of these things really need to happen outside the store in the community. So when they come to the store, they've already made some decisions about changing from whole milk to 2% milk, or white bread to whole wheat bread, or in fresh fruits and vegetables as opposed to canned. So we've worked with a number of consultants, including Mary Gallagher, and I'm sure many of you know her, about getting programs in the community that the grocer is directly involved with and commits to. So as a requirement of our loan, each grocer has to have a community engagement program. And some of them are with child care centers, schools, community health centers, even churches, clubs, YMCA. They take all different forms. So I'll stop there and can answer questions later. Thank you.
Thank you. Hello. Okay, so Louis' Groceries, or Lewis's Groceries, is a nonprofit organization. We were founded in August of 2011 with the mission of both improving healthy food access, but also of promoting healthy food choice. And so the basis of what we do is operate a small format neighborhood pilot grocery store at 76th and Cottage, which is in the Greater Grand Crossing community area on the south side of Chicago. And the store opened in December of 2012. It's a space of approximately 2,000 square foot. We carry fresh fruits and vegetables, and in the summer, we have a few organic, locally grown items from the Gary Comer Youth Center's urban farming program, which is right up the street from us. We sell dairy products, bread, fresh meat, as well as sort of packaged dry goods and your typical convenience products. And the other thing I should say is that we are also committed to selling fresh produce at an affordable price, which for us, because we are a small store with limited buying power, means we sell a lot of it below cost. So last year, our produce department pretty much ran at a negative 20% gross margin. So you can see why this sort of format is a nonprofit model, because that's something as a for-profit business you just wouldn't do. And so that's sort of the grocery store, and selling the fresh fruits and vegetables and the other items is sort of the supply side of the healthy food access issue. And then on the demand side, we have both sort of education and research programs. And so the education programs we largely do in collaboration with other organizations. So the University of Illinois Extension, there's someone actually here from there today, the UI Extension, the Illinois Nutrition Education programs, we've worked with them since we opened, and they've provided staffing and we've provided the space, and also worked together to recruit participants at Louis' Groceries for a range of programs. We had an adult nutrition class where beginning another course that focuses, it's called Money for Food, and it focuses on sort of food budgeting, sort of menu planning, and sort of eating well on a budget. We also have walk-by displays, which are sort of in the store setting. So I should say, so we have a demonstration kitchen as sort of a classroom space within the store. And so all of our education programs utilize both the store retail setting as well as the demonstration kitchen. We are beginning to work with EverThrive Illinois to start doing grocery, sort of in-store education grocery store tours using the Cooking Matters curriculum. We'll be beginning with that in May. And then we also have 3 volunteer chefs who do cooking demonstrations in our in-store kitchen on a regular basis. In addition to as we've all said today, we think education is clearly very important. We also think that there are other sort of maybe effective ways to get people to eat healthier. And so one of the things we're doing is working with some economists from local universities on more sort of behavioral economic research around healthy food choice. So currently, we're running an in-store experiment with John List at the University of Chicago and Anya Samek at the University of Wisconsin-Madison. It's a grant which we received from I think it's the University of Chicago Institute for Translational Medicine. And so it's an in-store study where we're testing the relative effectiveness of educational messaging as compared to economic incentives on the purchase of fresh foods and vegetables. And so So a lot of the research we're doing is, again, we're using the store setting. We have this retail setting where people are choosing what to do with their money, and we're testing a sort of a range of behavioral incentives that might also be effective in addition to education in shifting people's eating behavior. Yeah.
Hello. This is on. Once again, I am Connie Spreen. I'm the Executive Director of Experimental Station in Chicago. And my experience of food deserts and all the work that Experimental Station does around food deserts actually comes out of my experience living in a food desert in the Woodlawn neighborhood and discovering that we lived there for 20 years, and there was nowhere to buy anything. And so over the years, tried a variety of different types of activities to bring food into the neighborhood and spoke with our local leaders about bringing in grocery stores. And there was never enough of a critical mass in our neighborhood to enable a grocery store to come in. And so we were looking for low overhead means of doing so and decided to open start or launch a farmer's market. It's called the 61st Street Farmers Market, and we opened it in 2008. And from the very start, we wanted it to serve both a low-income population of the neighborhood, but also to sell organic and sustainably raised foods. And those being very much at odds with one another because the organics are much more expensive, or significantly more expensive. We lived with a moral dilemma in many conversations over the course of a year, and then in 2009, partnered with a not-for-profit on the East Coast called Wholesome Wave. And Wholesome Wave had invented this double value coupon program that they'd initiated out on the East Coast, and we were the first market kind of west where they wanted to partner and implement it. So we were the first market in Illinois to do so. And since 2009, have been the #1 market in the state of Illinois for purchases by Link card holders. So what our market does is we match Link purchases up to $25 per card holder per market day. And that provides a very significant support for the folks in our neighborhood who are on Link to be able to purchase the fresh and healthy foods at our market. And so we have seen the clientele grow significantly over the years. We collect a lot of data, and we also see the purchases that those folks make. And they are very significantly, they lean very heavily toward the fruits and vegetables, even though with their Link cards and with the double value, they're allowed to purchase meats and cheeses and dairy products and eggs and other sorts of healthy foods. So in 2010, the city of Chicago had engaged us to do their Link program for the city. So since 2010, we have been providing Link service at the City of Chicago Farmers Markets. In 2010, it was 5 markets, 2011, 10 markets, and since 2012, we've been providing service at 15 City of Chicago markets. And we have been also implementing double value coupon programs at those markets, and you can see the impact when you have not just the Link acceptance, but you also have this incentive that really enables people to afford those foods. So having expanded upon our own markets work around Link, having expanded to the city, we then also expanded around the state of Illinois since 2011, and we created a program called Link Up Illinois. It's a partnership between Experimental Station, the Illinois Farmers Market Association, and Wholesome Wave. Wholesome Wave provides all of the technological support, not the funding support, but the technology that we can use, and a lot of policy advocacy. So all of the markets we've worked with 40 markets around the state of Illinois in addition to our own, so 41 markets so far, and direct producer to consumer venues. All of the markets are trained to collect data, and we all collect the same data in the same way on a web portal that was developed by Wholesome Wave. All of that data gets collected for the state of through our program, Link Up Illinois, for Illinois, and then that is consolidated with data that is collected by Wholesome Wave from other partners around the country. So it's been a very powerful mechanism for demonstrating first of all, I should say, for improving access to healthy foods by our low-income population, and also demonstrating the impact of the program. So in the last year and a half, we've been able to get language in the Farm Bill to provide for federal funding for those incentives. So now that the Farm Bill is finally passed, there will be $20 million per year for the next 5 years for that kind of, we call it nutrition incentive. And so we're delighted about that. It's a federal 50-50 match, so the state of Illinois, or Connie, or Experimental Station is working very hard with a lot of different partners to ensure that we can have a stable base of long-term funding for this type of programming in Illinois, and then we can match that with federal dollars and bring those federal dollars back here. So I have a lot of other stuff to say, but I'll stop there.
Good morning. Rafael Malpica with Walgreens. I'll keep it brief because I think we want this to be more of a dialogue rather than a preach. So hopefully you're aware of Walgreens and who we are. If not, we are a national retailer with over 8,000 stores. And for this particular topic, I just figured I would give you a brief history of how we started our Food Oasis program and where it's been or where it's grown since we last talked. So the Food Oasis program is a program that we initiated to try to tackle the food desert issue. We tackled it, to give you an example, because we saw our footprint be so significant, and specifically in Chicago, 95% of the population lives within 1 mile of a Walgreens. And when we talk about African Americans and Hispanics nationally, 86% of Hispanics and 84% of African Americans live within 5 miles of a Walgreens. So our footprint by itself, we saw the opportunity to really tackle this issue and make a significant impact. So we started this initiative probably about 5 to 6 years ago with one store. We called it at that point Expanded Produce and Expanded Fresh Options, and that was in Madison and Western. And since then, about 3 years ago when the report was done, we had about 10 stores that we called our Food Oasis stores. And now we have, in Chicago, we have 27 stores. We've also expanded in New York, expanded to Colorado, California, Florida, and Michigan. And what we're doing is basically taking some of the space in our current stores, remodeling it, and offering fresh, healthy alternatives. To give you an idea of where we want to go with this project, we've made a commitment to the White House that we will have 1,000 Food Oasis stores throughout the nation by 2016. We're working on that commitment, and specifically to just give you some ideas of some unique collaborative projects that we're doing in Chicago. For example, in Chicago, we are working with the University of Chicago on a food prescription program. So we thought the opportunity of connecting our pharmacist as part of that healthy alternative and healthy education in conjunction with the University of Chicago and other health partners, federally health funded partners in the community would be great. So what happens? These patients that have diabetes go to these public institutions, go to the University of Chicago, and they get a prescription for healthy food that they then have to bring to one of 8 Walgreens stores that is participating in the program. They go back to a pharmacy, and the pharmacist walks them around and tells them, here's exactly what you need in order to manage your diabetes through healthy eating. So that's part of some of the programs that we're doing. We're also trying to encourage people to be healthier in growing their own food. We partner with an organization called Growing Power to make sure that we are locally sourcing produce and what we're selling. I will tell you that at times it's a little difficult because in a lot of our stores, people want to eat bananas and they want to eat oranges and apples, and I don't know about you, but growing an apple or an orange in January in Chicago isn't necessarily that easy. So those are some of those challenges that we are seeing as we're growing. And on top, we're also trying to connect with some of the internal programs that we have. Right now, we have a national tour called the Way to Well Tour. Basically, it's a Winnebago that goes throughout the nation to different communities that are underserved in healthcare access and provides free health screenings, about $100 worth of free screenings. You're talking things about total cholesterol, blood glucose, bone density, and those sort of things. You go through the Winnebago, and then at the end, you get results. And you get to talk to a pharmacist about what do those numbers mean? How can I take care of them? How can I do that through healthy eating? So I'll stop there because, yes, we can continue going on, but I think we want to begin the dialogue.
Great. Well, thank each of you for this very clear articulations of the initiatives that each of your respective organizations are working on. I noticed, it couldn't help but notice in your introductions, many of you touched on collaboration. There's obviously some collaboration taking place with some of the partners on the panel today. What I'd like you to do, and any of you feel free, how important is collaboration in efforts to improve access to healthy foods? What more could be done in the area of collaboration? And what type of supports could be provided, or resources could be provided to help facilitate or strengthen collaboration in this area? Anyone feel free to respond.
I'm happy to.
If you just mention your name again. As you...
Sure. Again, I'm Connie Spreen, Experimental Station. Collaboration has been key to all of the growth that we've had with our programming at Experimental Station around food and what we call food culture. We work, as I've mentioned, with the City of Chicago, with Wholesome Wave, the Illinois Farmers Market Association, with 40 other markets around the state. What we're currently discovering, and part of this is, as I mentioned, we're looking for steady and long-term sources of funding. That comes through all sorts of different kinds of partnerships. For us, we are looking at the healthcare sector as a major partner in helping to provide funding for double value incentives for the state of Illinois, partnering with hospitals, partnering with the Illinois Hospital Association, partnering with the American Heart Association, and many more. I mean, it's absolutely critical because there's so many components that need to be addressed that no one person or no one organization or entity can take it all on by yourself.
Bechara Choucair with the Chicago Department of Public Health, and I do want to echo what Connie mentioned. I mean, every organization represented here on the panel has been a great partner to the City of Chicago in making a difference. And unless we really continue that type of collaboration and that type of focus on bringing traditional partner but also non-traditional partners, there's no way that we could make a difference when it comes to access to healthy and affordable food. You know, one example of one of the programs that I touched on very quickly is our Neighbor Cart project, where you have these kiosks that are selling fresh fruit and vegetables, mostly in low-access communities. And it took, the City of Chicago, it took City Council, it took many city agencies, including Business Affairs and Consumer Protection, but it also took Streetwise, it took Neighbor Capital, a for-profit social entrepreneurship organization, to be able to create a program where individuals either recently getting out of jail or recently getting out of homelessness to be able to train to become small business owners to manage and run kiosks that are selling fresh fruit and vegetables. So it takes a village to get any one of these projects to go up and running. And I think the key is for people to know people. The key is for organizations to be willing to partner and to really eliminate barriers from who needs to be working with who.
Obviously, this is a topic we all like because we all have to do it to do our jobs. We like to say collaboration is the new competition, because if you collaborate and you do it appropriately, there's much higher value for everyone. And it's not easy to do, but it's so critical to success. And I mentioned that we're financing a store in Waukegan, and it's in a location where there's just enormous, huge food desert, off the charts in terms of access problems. And it's on Green Bay Road, and there's enormous traffic that goes up and down Green Bay Road, so we're convinced it's going to be successful. And on the other corners are a Home Depot, an elementary school, and I think there's a Walgreens up there. So this grocer is challenged for community engagement to start with looking around and figuring out how can I collaborate with Home Depot, an elementary school, to increase my business and theirs and the eating habits of the people who are going to walk into my store and are going to be my customers. And it's very exciting to see this play out. We're not dictating anything, but we're supporting the conversations. And we've seen lots of other similar models. But that's just on the store level. On our institutional level, Yes, we collaborate with everybody. We have investors, we have funders, we have all kinds of partners that come together to make our programs happen, and especially the Illinois Fresh Food Fund.
Oh, go ahead.
I was just going to make a quick comment about the way that we collaborate in Inglewood, especially around outreach when it comes to getting the word out about, the fresh food options, about the fact that we have a Wednesdays at Wood Street farm stand. One of our biggest problems in our neighborhood is there's no consistent and dependable mode of communication of positive initiatives. We don't have a newsletter, we don't have a newspaper. There isn't like one website that everybody goes to get community information, so we really have to rely on our collaborative partnerships with our organizations to get the word out. I partner up with EverThrive because we share the same audience of people who need access to healthy food, and I partner up with Imagine Inglewood If, not just in communicating what we're doing, but also in our events and our different initiatives as well. So even partnering with folks or organizations that have nothing to do with your mission, it kind of helps, especially when you're trying to get a select group of people, which in our case are the people in Inglewood.
Yeah, just a quick comment. I think the key to collaboration is what I would call innovative and open collaboration. And I guess let me explain. When we first started this, we hadn't carried that much fresh produce, and part of the struggle that we went with was reverse logistics. Of course, we would love to sell everything that's at our store, but reality is sometimes it doesn't happen. So we didn't want to go all that produce to go to waste. So what do we do now? So started reaching out to partners, and eventually got to Feeding America, which also is part of the Greater Chicago Food Repository is part of Feeding America, and trying to build a program where now, instead of just coming once a week, we need you guys to come to the store more often, because the produce isn't going to stay that fresh for that long. So innovation or collaboration that's it also is innovation, but also open. And to give you an example, we are working with an organization called Growing Power. They are a small nonprofit organization, and they were trying to serve about 10 of our stores. And, my business people and my merchandising people were expecting Growing Power to give them the sort of produce and volumes that a Procter & Gamble would give you, or that sort of. So also trying to say, hey, reality is this may need to be a little bit more open, because what's going to work for my nonprofit business partner may not work for a business partner and otherwise. So I think that's a key, is that this particular issue, as you can see, is very diverse. You can have many different partners, but you have to be open and innovative.
As a follow-up to open and innovative approaches, and thinking of trying to solve the food desert issue from a macro systems level. As we know, food desert is really not the cause necessarily of, or some argue, I should say. The food deserts are not necessarily the cause of poor health conditions, and rather food deserts is more of a symptom of a larger issue. And if we think of collaboration from a macro systems level, what collaboration is taking place with other systems or planners and systems that are working on issues of transportation, economic development? So where's the connection between those of us or those of you working in food justice and maybe somebody who is working in transportation or job development, or someone wants to answer that? Where's that planning taking place or collaboration taking place?
Yeah, thank you for bringing a very, very important issue. I mean, addressing access to healthy and affordable food is definitely not just a public health issue. It really touches so many disciplines, and the fact that the panelists here represent different sectors of our community is really a testament that this is really happening. I think when people ask me what is most exciting in public health these days, I'll tell you it's two areas of intersection. It's the intersection between public health and clinical medicine, but equally as exciting or even more exciting highlighting is the intersection between public health and economic development. And I think, the work that IFF is doing, there's, over $150 billion in economic investments for economic development projects, and really public health needs to be at the table so that we can work with these partners to see how we can make a difference. The same things with experimental station or Walgreens or the, not-for-profit grocery stores. These intersections have to happen to make an impact at the long run when it comes to public health issues in general, not just food access issues. At the end of the day, to have healthier communities, it's a lot more than providing the community with access to doctors. It's about having, empowering people to getting out of poverty, empowering people to get better jobs, better education. And when we focus on those social determinants of health, that's really how we get healthier communities.
So I'm not aware that there is such an initiative going on, but to your point about, well, the cause isn't the food desert, the cause is, maybe the urban infrastructure, poverty, what have you. I would say that I think we should sort of keep in mind as a general theme that, opening a grocery store, like what we do at St. Louis Groceries, opening a grocery store in a food desert is not necessarily the most efficient way to go about it, right? And so if you're interested in affordable access, you might say, do some cost-benefit analysis. We can open a store, or we can just run a shuttle program where we take people to other neighborhoods. And yes, there are other arguments to be made for why you'd want a store in your neighborhood, but if the issue we care about is affordable access, then I think it does behoove someone, and I'm not sure what sort of the appropriate entity would be to sort of consider and work on this issue. But yeah, you might consider, say, running a shuttle program, like a mass citywide shuttle program as one option. If you really care about affordability, you might say, well, perhaps it would be wise of the federal government as part of SNAP to set aside a certain amount extra, or however you want to do it, that's specifically for fresh fruits and vegetables and other sort of healthy items. And so it sounds like, this Double Down programs have been very successful, and I know that the USDA recently ran a pilot where they, where food, it was, I forget which county it was, but it was a countywide pilot in a state, and they, food stamp recipients were given extra dollars. It was actually a randomized experiment. Food stamp recipients, sort of a selection of the sample of food stamp recipients were given extra food stamp dollars for buying fresh fruits and vegetables, or maybe it was just fresh fruits and vegetables. And they found that actually had an effect. And so I think sort of the obvious solutions that come to us is let's open something that's a piece of physical infrastructure that might be a nonprofit grocery store or a for-profit store or a farm, but we might also just sort of, I think there are existing infrastructures that we could very much make use of, and just sort of apply funding to certain programs in different ways that might incentivize different behaviors. Yeah.
Terri reminded me of something I thought would be extremely appropriate at this point to mention is when we, our work on pediatric obesity as a city has been going on for years and years, and it really started by bringing different city agencies to see how different city agencies, from the schools to the transportation department to the parks district to the family and support services, could work together to address pediatric obesity from a government perspective. What are things that we can do to make a difference? And that model, that interagency council to address pediatric obesity, is a model that Mayor Emanuel asked us to take it to the next level when he released Healthy Chicago, and he asked for an interagency council to implement Healthy Chicago, because we know that if we want to make a difference on the health of our communities, we have to involve different city agencies. And I know the concept of health in all policies is a new concept that's been gaining a lot of steam, and that's why these types of efforts really make a difference, not just on pediatric obesity issue. We're implementing, we're using that council to make a difference now on enrollment for the Affordable Care Act, on other different examples of how we can engage different city agencies to have that venue to do that type of planning and thinking.
I think that it's already very interesting that public health is at the same table with food. That's really a giant step forward. In our experience with engaging the health sector, and part of this, it essentially came out of the fact that with the ACA regulations around hospitals, some of the new rules, they are requiring hospitals now, if you're a not-for-profit hospital, and you are required to return to your community 5%, to retain your tax-exempt status. And in the past, and I'm not going to criticize the University of Chicago Medicine because they're one of our partners, but at the same time, I am going to state what I read in their community benefits report a couple of years ago, is that new buildings was a community benefit for them because it promoted local jobs and promoted and stimulated the local economy. With the new ACA rules, not-for-profit hospitals actually have to demonstrate health impacts, which has transformed the way that they are thinking about that funding. And also with the new Medicaid rules where the hospitals are not going to be reimbursed for patients who are returning within 30 days for the same condition. Medicaid, the federal government, is not going to be reimbursing them for those costs. So they've been forced to shift drastically and very quickly toward a new model which includes wellness and prevention and engages the health or the food sector. So it's the reason that we have been trying to, in the last year, we're ahead of them, but they're starting to catch up. And they are starting to get it, and that is going to be for them a very important way for them to engage the communities through their community benefits programs, and by helping to support food-related programs.
And just today, was it your report that came out today? Did you do it? There's a report that just came out today on the Affordable Care Act and hospitals.
Yeah.
And I haven't read it yet, but it's in my purse to read. So this is a new area that may or may not generate cash, but it has to generate attention.
Yeah, this is such an important issue, and I know a lot of us, when we think about the Affordable Care Act, we've heard a lot about the insurance reform. That's what got covered. That was what all the protests and all the media coverage was about, insurance reform. But there's a huge aspect of the Affordable Care Act, in my mind, is probably the most important aspect of the Affordable Care Act, is redesigning our healthcare system. And the way the future of our healthcare system is very, very different than it is today. And it's really backed up by payment reform, a lot of really shift the focus on what we want to pay as a country when it comes to healthcare, and we're going away from paying for service. So when you go to see your doctor, your hospital system or your healthcare system is not going to be eventually reimbursed by the number of widgets of services that you guys have received. Those healthcare systems will eventually be reimbursed based on the health and wellness of these communities, and that's why you're going to see a lot more of these accountable care organizations, accountable care entities, care coordination entities, really focusing on investing upstreams before residents in our communities are touching our emergency rooms or touching our healthcare systems, because we do want to keep our residents healthier, which is basically public health 101. That's really the exciting part about the Affordable Care Act that unfortunately didn't get a lot of coverage in the last few years, but I think now it's picking up a lot of steam.
Yeah, I just wanted to address that. I think you can see that everybody here is rather passionate because we're grabbing microphones and saying, no, I want to say something about this. So yes, I want to say something about this. I am glad that food and health are together about time. And I think that's what some of our collaborations have been all about. We started with diabetes because people just simply weren't seeing if I eat healthier, it actually affects my diabetes, and multiple disease management. And what we've also found is, of course, as a business, we've been able to highlight to communities, well, guess what? You have a healthcare professional in your community. It's called a pharmacist. If you have questions about your diabetes, your heart disease, your whichever disease you have, you can probably go to a pharmacist for free and ask a question. How do I manage it? So for us as a business, it's been good because that's something that we've wanted to highlight. We want to be a point of healthcare, not only with our pharmacists, but also our healthcare clinics, and trying to decrease the cost of healthcare for our communities rather than you having to go to an emergency room for something that you can go to a healthcare clinic for. So absolutely, I agree that just the progression of food and health together has been great.
In the interest of time, we have about 4 or 5 other very important questions that we need to get into today's discussion. I'm going to respectfully request that only 2 or 3 panelists respond to the next question, and you guys can figure it out among yourself who's going to do that. So the next, what I think to be a very important question is measuring outcome. A lot of times we become very myopic in our approach and focus on process. And sometimes what gets lost is are we really having an impact? Can you take a moment to describe the measurements for your various initiatives and basically how are you measuring impact? And based on those measurements, have you been successful, or is there additional work that must be done, or both?
I can do a real short one. How's that? Our outcome has to be the success of the store, so the store repays the loan so we can keep making more loans. But also we're measuring the community engagement program that the grocer enters into an agreement with us on. And it's much too early to have any measurement of that, but we're very excited about that and hope that in a year or so we'll have great reports coming out of those communities about people changing their shopping habits.
I think I reported some of ours, but we measure our impact by our sales numbers. So for the past 2 years, they've been continually doubling. We do expect them to double again this year. And our attendance as well. I think things that we could use help with, and that speaks probably for all nonprofits, is with outreach, basic outreach, and getting the word out.
Sure, I got a simple one. Yes, we have measured sales. So in cases where we see increased basket sizes, and we have and I will be honest, in some of the stores where we've remodeled and now it's a food oasis, we have seen increased basket sizes. So yes, it's been successful. But what we've additionally done is trying to see what the health impact is. And we've done studies about when we turn a store into a food oasis store, does it impact the amount of people that come to the store for, say, a flu shot? And it has, because people see it as more of a healthcare destination. So we have studies like that, and at the same time, in partnerships like the one with University of Chicago, we have been able to track individual patients and seeing how have your numbers decreased, whether it's in your blood glucose, whether it's in your medication management, how have we been able to improve your health, and we have seen great outcomes from those individual patients.
I know you wanted us just 2 or 3, but I feel compelled to say that. So from a public health perspective, obviously the health of our community is something that we care a lot about, and we actually track over 16 different metrics as part of our Healthy Chicago initiative. And one of these metrics is related directly to childhood obesity. And I'm happy to report, and we continue to issue yearly reports on childhood obesity, and I'm happy to report that over the last 10 years, we're one of the very, very few cities in the country that we're starting to see turning the corner around pediatric obesity, and our rates of kids entering kindergarten, the obesity rates of kids entering kindergarten has gone down from 24% in 2003 to 19% in 2012. That means 1,000 kids are entering CPS kindergarten every year at a healthier weight. That, to me, is really the outcome of all of our work together, that providing those kids with a healthier future.
Over the next 5 years, what do you believe will be the greatest challenge in distributing healthy food in low-access neighborhoods? Greatest challenges over the next 5 years. And how do you think these challenges can be addressed?
Well, so I think the greatest challenge is, I don't know that this is something that has changed from now compared to the next 5 years, but I think it's basically poverty. And so, I mean, how it can be addressed is either, this is where I'm not very hopeful, because, we as a society have decided that, that we shouldn't necessarily raise the minimum wage, or we would like to cut food stamp funding. And so I think that, I would say that the thing that we have experienced firsthand at Louis Groceries, and that I'm sure a lot of people here have experienced, is a basic affordability problem. And unless people's sort of employment and income picture gets better in the next 5 years, I don't see that the food access picture is going to get better in the next 5 years. And I'm not sure that's something that a lot of us in our capacity as people working on food deserts are necessarily in a position to do something about. That's something much larger, which is very unfortunate, and it is what it is.
I think that some of the greatest challenges are going to be, we just don't have locations of healthy and affordable retailers and markets. If we could encourage more reputable food retailers to come to our neighborhood, we would be better able to distribute healthy food. With increased community development, that would attract better stores. And contrary to popular belief, we have a lot of buying power in our neighborhood. We take our dollars outside of our neighborhood. What would our neighborhood look like if we were able to spend that money in our community, being able to eat and do all the other things that we need to do in our neighborhood? Simple things like go to a pet shop. There's currently no organized farmers market in Greater Englewood, but I hear there used to be one. Though from time to time, certain farmers or single farmers do have their own farm stands. It would be great if we could have one big place, maybe like a permanent market. For example, there is a plan, and there are many different plans in Greater Englewood, just none have been implemented on. There's a new era trail plan to turn the rail line along 59th Street into a trail, right? And so in there's a recommendation that we have a permanent market. I think that that could definitely help us out in this area, specifically because we're going to be becoming the urban ag district, and there are going to be lots of more farmers coming to the area. We also have a very close relationship with the black farmers that are down in Pembroke, Illinois, and I know that if we had a permanent place right now, we would definitely be able to impact not only food access, but also be able to spark a little bit of more development. I've touched on this before, but there's no consistent and dependable communication of these healthy food options. You know, if we live in a food desert, then I think that everyone should be breaking their back to let residents know where those healthy food options are and where those education options are, where you can get help on nutrition and cooking. This information should be shared wherever people are receiving services, especially those related to health. I think that's it.
Yeah. No, I just wanted to agree with Sonya. One of the things that you touched on was education and outreach. And I think that's huge for us because reality is, listen, if I put healthy alternatives in my store and they don't sell, they're going to get taken out, period, end of story. And I know a lot of other retailers that we've spoken with that said, hey, we put it into stores, but folks aren't buying it. So we need to take it out. So I think part of that is education and outreach. And to your point, letting people know that it's there. Letting know people that it's there, and I know that I'm currently working on a project not only letting people know that it's there, but it was grown in your neighborhood by people in your neighborhood, so that there's a residual impact outside of you're just impacting the health, you're impacting the economic development of the neighborhood. So I think that there needs to be a larger focus on actually we're addressing the issue by expanding access, but not letting people know why that access is important.
Sorry, I'm probably number 5. One of the things that we had done in the last few years around the Double Value Program was partner with CBS Broadcasting, their community partnership division, and they produced for us a 30-second ad that we ran on with Chicago Community Trust money. We ran on Channel 2 for about a month in the month of July, advertising that program. And from the day it started, that ad started running, so they ran it maybe, a dozen, 15 times a day. And it was targeted, the Judge Judy hour and that sort of thing. So it was very targeted advertising. But we saw 300% and 500% increases in the purchases by the folks in the neighborhood around the city of Chicago, West Side markets, and I mean all over the city. So we do a lot of data collection in a lot of different ways, and that was some of it. And so that outreach is very, very difficult, but we discovered television was by far the most effective means that we have found so far.
And I left out one challenge. I just think we have an oversaturation of corner stores and liquor stores that do not promote healthy eating and do not stock healthy food that young families depend on for nutrition. I think that we need to drastically reduce the number of these stores and/or help provide them with resources they need to help stock healthy food, such as refrigeration, training, lighting, and that will help to kind of change demand as well.
Great. Since we're talking about challenges, I did have a question forwarded to me from one of our panelists, Trinita Logue, with the Illinois Fresh Foods Fund. You mentioned in your opening statement that you were only able to make one loan in the city of Chicago. How much is currently within the fund? And can you elaborate a little bit more why the fund is so challenged to make loans to open up grocery stores in Chicago?
In Chicago. Well, believe me, I wish it were different, and we've continue to work at it. We only have a couple of $1 million left. It was a $10 million fund, and it's up September 1st. So we only have a couple of $1 million left. We have a lot of projects in evaluation and under discussion in Chicago, and we certainly are hoping that we will achieve the last few projects we're able to do with these funds will be in Chicago. But I think that some of the, I don't have any scientific evidence of this, but in Chicago there's so much more competition. And there's a lot of grocery store chains that have 15 stores, 20 stores. Central has 60 stores. And these aren't the big box stores like Jewel or Dominic's, but it's sort of the mid-level part of the industry. And even those are very, very stretched to go into neighborhoods where they don't have the exact right metrics around density and income that they need to know that they're going to make a living. So we've worked with a lot of independents, not even in the grocery industry already, who want to become grocers or who want to open a store, and many of them simply can't pull together the resources needed to do it. And we've worked the most with those kinds of independent grocers, hoping to help them. And there's some programs through the state DCEO, there's some programs with the city, in some cases there's TIF, in some cases there are other programs, but we haven't had enough of the resources coming together to bring about what we would like to see. However, we haven't given up, as I said. There's a number in discussion, and we're hoping to spend the remaining $2 million in Chicago. And our funding leverages other funding. So if we put $1 million into a store, another $1 million may come from a bank. Some of the grocery chains like Save-A-Lot have incentive programs with grocers. They give them grants and they also lend them money to get started. So we work with all of those programs. But a grocery store, even a small one, a 15,000 square foot grocery store, is very hard to get going, and city land is expensive. So,
just as a follow-up, something that I am intimately knowledgeable about because I'm going to actually move my family to the South Shore community, and Dominic is no longer there. The South Shore community is having a challenge in terms of locating a grocer. Is there any communication with the Illinois Fresh Foods Fund and the South Shore about what's going on in the South Shore?
Yes, but not from that Dominic's. And there's a couple of movements to get a store into that Dominic's that we've been following that is locally initiated. I can't remember the name of the grocer they're working with, but there are some moves going on. And what else did I hear about that Dominic's? That maybe Jewel or somebody was also looking at it. So we are watching that. But that's a big building. It's a big building.
It's also community with deep pockets.
Mm-hmm.
I am actually a South Shore resident, and as you were talking, I'm thinking to myself, I need to talk to her and see like what is going on in South Shore.
Let's talk offline, yeah.
Yeah, the Dominic's that's on, or was on 71st Street, is the only Dominic's location in the Chicagoland area that has not been snapped up by another grocer. And so, I mean, I've been told that there are issues with that building. It requires like over $1 million in changes in the structure. So I would definitely like to talk with you to just learn more about the role that you've been playing in bringing some kind of grocery store to that community.
When we can get city land donated, and sometimes that happens, but sometimes it doesn't, it makes a big difference. And when we can get TIF, it makes a big difference. If it's a private owner and they're trying to get their money back out of their property, it's not usually touchable.
My next question, similar to the lack of a universally accepted term for food desert, there appears to be some ambiguity around what constitutes access. So how do we define when we say, well, this community has access to affordable and nutritious foods? How do you measure that? What does that mean?
Can I take that just for a second? We use a methodology called the low access area methodology that was developed in Philadelphia, where they've been on the forefront of doing a lot of this stuff. And it basically is based on the idea that a community with a certain density and a certain amount of car ownership and a certain, some other characteristics like ample transportation, should have the same access as a higher income community of the same density and the same car ownership and the same transportation option. So where I live on the north side of Chicago, I have 6 full-service grocery stores, probably within 10 blocks. And I have tons of buses, and I have the L. I do not have a car, but I don't need a car where I live. So a community that's low income but has those same other characteristics as where I live doesn't need 6, I don't need 6, but should at least have full access within a reasonable distance. So that's the methodology we use. It compares, we want the exact same model for all characteristics except income.
We don't use any methodology at all, I have to say. We just use our experience. And when we started the 61st Street Farmers Market, we defined access as simply bringing the market to the neighborhood, and also then making the food accessible to the extent that we offered link. And then we realized, or we accepted link at the market, and then we realized, well, that didn't make it accessible either because people couldn't afford it. And so we introduced the double value program. And then we thought, well, that really doesn't make it accessible either, totally, because people in our neighborhood don't really yet know how to even identify that food and cook that food and enjoy that food. And so, we've built a whole food culture education program at Experimental Station and with the local Carnegie School, increasingly partnering with the school to try to rebuild that culture, but accessibility has become just much more of an expansive term for us, just based on our own experience over time.
Go ahead. So we just say that you should be able to walk to a grocery store in an area, and for the past 30 years, in my experience, I have not been able to walk to a grocery store in my community. I would also like to add that if you look at the number of preventable diet-related deaths in our community, that can kind of lend itself to what's going on.
Yeah, I would just say we use, to begin with, the USDA Urban Desert Map, and then also rely on the Partnership for Healthier America. After that, we look a little bit more in depth at income level, local grocer count, population density and mobility, and after that, we rely on kind of our market and field experts, i.e. our employees, because usually they're living in the community, and talk to them and say, is this really a food desert? Do you need it? And those all in combination with other metrics that we need in order to put a store there or change a store location, that's what we usually look at.
This is my last question, so it looks like we'll have enough time for every panel member that wishes to respond to respond. And some of you have actually touched on the response, but I think it really deserves some additional discussion. Some argue that access is not enough, that a field of dreams, build a grocery store, and they shall come approach is insufficient. According to a 2011 study published in the Archives of Internal Medicine, which studied, I believe, 5,000 residents in 5 urban communities throughout the country, found that there exists no connection between access to grocery stores and more healthful diets. What other strategies, number one, do you agree with that, or do you have research that would maybe refute that? And, or what other strategies, in addition to increasing access, must be implemented to improve the adoption of healthy diets in communities that are labeled food deserts?
I can start by trying to answer these questions. I think some of the research that we're seeing right now is still very early to be conclusive. I read this article. I think there was a recent article about a study in Philadelphia that looked 6 months after you open a mainstream grocer. I think we're going to need more time to really evaluate the impact of bringing access to communities. I know I was a part of a study that was done here in Inglewood by a group of researchers from University of Illinois, Boyd, and others who've looked at and followed and talked to residents in Inglewood that actually showed that when you take these residents to grocery stores, they would purchase the healthier items. I think this is too early to make a decision, to make a final conclusion on whether bringing access will resolve the issue of healthy choices. But that definitely is a sign that we, is another confirmation that we need to partner these, bringing the stores with definitely a lot of education, a lot of what we've heard about cooking demonstrations, classes. We're in 40,000 homes in our in our communities doing a lot of work with our nurses, so they do a lot of that one-on-one education, community educations. But I do want to, conclude as kind of like the best way to address these challenges, something that Terri mentioned earlier. We have to address shifting culture, shifting norms in our communities, and we can only do that by addressing those social determinants of health, by really focusing on social issues, by looking at poverty issues, by looking at income inequalities, by looking at minimum wage, by looking at immigration reforms. These are really the good long-term solutions to these issues that we're dealing with. And unless we are serious about making a difference on income inequality, we really are not going to be able to address food access issues on the long run.
I'd like to say that if I'm going to speak just from the community standpoint, more from a growing home standpoint, but if you have not traditionally had access to fresh and affordable food based on what's available in your neighborhood, if it's been a long time, 40 or 50 years, as in our case, then you have altered your diet. You're not used to eating the way that you should be. I think that could speak to some of that research. I'd also like to offer my personal testimony in that I'm 32 years old, and I am the oldest person in my entire family. In the past 5 years, I've buried all of my family, and they've all died from preventable diet-related diseases. I remember as a child, one of the biggest things my grandmother used to do was we would have to go to the white folks' neighborhood to go shopping, and this was like 20 years ago. I think that kind of speaks to why we traditionally have not been eating maybe in a healthy and affordable diet, and that's why the demand is not there yet. So there's some other things that need to be considered besides just the numbers that say if you bring in a grocery store, people are not going to automatically go there. It's not going to change their health. There are some other reasons why. I just wanted to add that.
I agree with everything.
No, go ahead.
So again, I keep hopping on this. I think affordability is key. So last year, 20% of the items sold in Louis' groceries were produce, which for a small corner store is a lot, but the price is right. We sell them with negative margins, and so there's certainly. In our community, there's certainly demand for produce, but that demand is perhaps at a lower price than the prevailing market price, which leaves you in a bit of a dilemma as a business. And I think that is, access, but it has to be affordable access. And the other thing I would say, just another anecdote, is that we have a food pantry. So there's a church immediately next door to us on the south side, and the church has a food pantry on Fridays. And so what people will do is they will go to the food pantry first and get whatever they can, and then they will come to the store and buy the few items with the money they have, which they were not able to get at the food pantry. And there's very much this patchwork approach of you get food wherever you can. People are very income constrained. And I think that it's difficult because I understand that, as a large full-service grocery store, you have very, very high operating costs. And so to go into a low-income neighborhood, there are issues of, are you going to get the volume of sales? What price are you going to offer things that you are still able to make money and actually sell it to people at an affordable price? And I think affordability is the trickiest part of access.
At the 61st Street Farmers Market, we do a fair amount of data collecting, and one of the things that we track over the course of the year, and particularly at the end of the year, is what percentage of SNAP and the double value coupon programs were products. And I think it's telling that in your store, 20% were spent on fruits and vegetables. At the farmers market, it was 51%. That is our SNAP population. 51% of the $20,000 of Link and $18,000 of double value that they spent at our market last year were spent on fruits and vegetables. And the next chunk of more than 20% was for meats and cheeses and non-sweet bakery items and all of the other types of staples that we would consider healthy foods. And a very, very small percentage of foods purchased at our farmers market were anything that had a significant amount of sugar in it. The vast, vast, vast majority are very healthy foods. So part of what we've discovered is that when at a farmer's market, you already have a much more limited product line, but given that much more limited product line, people select very well from what is there. And we have on our website somewhere some sort of national study, I forget the origin of it, but it stated that across all Americans, 14.6% of American dollars spent in grocery stores are spent on fruits and vegetables, on fresh fruits and vegetables. So already Louis' grocery store is doing better than that, and the farmer's market is doing significantly better than that.
Yeah, I just wanted to add that in order, I think, to move to the next level, while the conversation here very easily turned into food and health, I don't think that happens in the community as often. So that's part of the changing in culture. Yes, because there hasn't been that access, so I haven't had that conversation before. But to address the impact of access, I guess I can just talk a little bit about just some personal experiences that I had. So we opened our first food desert store. It was in 16th and Stony, and at the time, Mayor Daley came. We had this huge celebration. Great, we have all these products in there. About 3 months after that, I was driving by the store. I was like, you know what, let's see how the folks in there are doing. Where's Tanya? Tanya was the store manager at the time. She came from the back, and I was like, wow, you're looking good. She had lost 30 pounds. Why? Because there was an easy change to diet. I'm working at the store, so rather than going to 8 or 10 different fast food chains, not that there's anything wrong with choice, but instead of doing that every single day, I can just go to the cooler and get some, a cup of fruit or a salad, and then she said, well, hold on a second, I'll be right back. And she brought me 5 other employees who had dropped 10 pounds, 20 pounds. To me, it was amazing just to see that, A, there was the option, and B, it was easy. And you get a 15% off because you're a Walgreens employee, so I agree with the affordability part. But it was, I think there is a huge impact to convenient access because I just saw it in front of my eyes. And that was something that, quite honestly, when we were thinking about all the different outcomes, we didn't expect. Yeah, of course we want our employees to be healthy, but just we were doing it for customers and communities, and we went, oh my God, we're improving the health of our own employees. So.
Just for a point of clarification, because this is going on record, I think Rafael meant to say when he opened their first food oasis.
Yes.
Not food desert store.
Food oasis store and a food desert.
Great.
Thank you.
There we go. So at this point, what I'd like to do is provide each of our panelists with 1 to 2 minutes to provide us some closing thoughts, closing remarks. And I'd like to begin with Rafael and move toward me.
I guess I just gave you my closing thoughts, but honestly, I think the the key to moving forward with this particular issue is going to be, collaboration and continuing the process of, in our communities, just saying there is a connection between what you eat and how healthy you are. And I know that in the past there hasn't been that access, but now we need to work together and understand that my model might not work for my nonprofit partners or might not work for government partners, and be open to collaboration in innovative ways.
I guess my final words would be almost like his, Rafael's. The importance of innovation in this arena is, I don't think can be underestimated or overstated, because as things are moving for us, there's always we're a not-for-profit, a funding problem. That's a challenge that we face every single day of the week, every single minute of the day, and that funding challenge keeps me and us moving constantly. Where is the next opportunity? How do you partner with the right people so that this, can happen? And so you're constantly innovating, constantly thinking about how to do the next thing that will actually have a real impact. And whether it's a food and veggie prescription program, working with the health sector, we're doing a number of new things that will be announced in the future. All of that, it's always new innovative programming and always new sources of collaboration.
I don't have any final thoughts, but thank you everyone for coming.
Wherever we end up deploying these loan funds, when the loans are repaid, the program continues with the repaid principal. So we're excited about being part of the future too, not just the present. And I think innovation is going to be a key to it. And we'll see all kinds of new grocery store models too, as you've heard here.
I believe that food is medicine, and when you're not properly fed, you don't think or behave right. When you're not properly nourished, when you're properly nourished, you can operate at your full potential. I believe that as a community, we are not operating at our full potential because we lack basic nourishment for the body and the mind. I think if you live in a nice neighborhood, free of crime and full of successful businesses, banks and grocery stores, then you get to eat right. However, if you live in a place that has been cleared out for some reason of all community centers, programs, reputable businesses, and grocers, then you leave for the people who are left food and liquor stores with high price, sometimes out of date, old and unhealthy food. You get used to eating this food over time unless you leave that neighborhood and really pay attention to food access in other communities. This is exactly what we work to fix at Growing Home: improve food access, quality of food, education of what healthy food is, and of course education of gardening so that people can feed themselves and also enter into a mindset of community and love for the land and love for each other.
I want to thank everybody for coming here today. I want to thank my co-panelists and Malik for great moderation. But I really want to end by saying, I think from a leadership perspective, there's no doubt that the mayor is definitely committed to addressing this issue, and he asked us to do whatever we can to make a difference. So as city agency and all of my sister city agencies, we're really here to make a difference, and we're ready. We've been rolling up our sleeves and trying to think about out-of-the-box ideas, being innovative. So if anybody has any more innovative ideas, out-of-the-box ideas, please don't hesitate to let us know via email, via phone, via Twitter, via Facebook, whatever it takes. We're here to really solve the issue, and we'll be happy to learn about different ideas.
That ends the panel discussion portion of this meeting. Now what we're going to do is transition into an open session, and if we have people in our audience that would like to ask a question of the panel, we ask that you stand up, state your name, provide us your affiliation, and to speak loudly because we don't have a microphone to head over there. We think this is small enough room, everyone should be able to hear. So beginning with this gentleman here.
My name is Daryl Mitchell, and I'm an accountant. I'm also a entrepreneur. I work at the Village of Robbins, Illinois. I'm from the Village of Robbins, Illinois, and I wanted to say I appreciate you guys having this. I was told about this, and mainly because I'm actually bringing the supermarket to Robbins. Robbins, some people have seen my billboard, some people have seen emails and things like that. And just being able to work with IFF, I'm actually working with Robin Broman right now. We just had a market study done by Murray Gallagher. So a lot of the things that you guys are saying is actually right on point. One of the things that Sonya talked about is really just bringing the businesses to these communities and having the business that are willing to make that investment. And at the end of the day, you know, sometimes when you put the store there, people will come, but you have to mix that with the right marketing, you have to mix that with the right business operations, and everything has to come together along with making that community engagement as well. And my motto, we're doing all of that. You know, we have a letter from the White House that talks about the Let's Move program and being able to bring an educational component as well. So I just wanted to say that I really appreciate everybody giving their input. I walked away with some more information that I didn't have. But at the same token, you know, we have to not just sit back and just wait for it to happen. If it's in our communities, it's left up to us to get up and say, you know what, I'm tired of what the reality is, and try to make something different. And that's what I'm doing in my community. So I just really thank you guys for being here. Please be on the lookout. If you guys want to follow what I'm doing, you guys can email me, or you guys can just get my card. Go to my website, dmgroup1.com, and you guys will see all of the information that we have, letters from the White House that compliment on things that we're doing. So we're just trying to, you know, break the cycle. Thank you.
Can you please restate your name?
My name is Daryl Mitchell, and I can be emailed at info@omega-incorporated.com. But if anybody wants to talk to me, I'll kind of wait around and give you some information as well. Thank you.
How you doing, Malik? I'm well. My name is Will Myers. I'm the founder and executive director of an organization called Fathers for Change. We're based in the South Shore community, and I'm intimately familiar with the issue of Dominex. One of the challenges that we face in South Shore is the fact that South Shore is a community that has 3 leadership networks, and those networks don't work well together. There are those that have and those that have not in South Shore, and that has fragmented the community sadly. The loss of Dominex has caused an emergency situation for us. I just want to tell of a story. That Dominex closed on 71st and Jeffrey on the 28th of December. That same afternoon, it was a snowy day, and I saw an older lady pulling a cart right out front of that Dominex. Now, they never shoveled the snow from in front, so I had my own groceries and my own bags that I had to go to Family Dollar to get, and Walgreens. So when I asked her if she needed help, she told me, no, I can do it, young man. So she was independent, but the problem was it made me think about my mother and the fact that there are folks that live in our community in South Shore where they have deep pockets, but South Shore is also full of folks that are senior citizens, that are on fixed incomes, single mothers with children with no vehicles that are on single income. There are disabled folks, shut-ins, and we need something that makes a difference. So somehow I forwarded to Malik a concept that we're proposing to replace that Dominex on 71st Street. It's viable. What we're interested in is checking or investigating its feasibility. And so I want to get thoughts from the panel on how effective or how feasible are multi-stakeholder owned co-ops. Now, some folks in the community are advocating for Mariano's, Whole Foods, Trader Joe's, and things of that nature. But we still have an audience in South Shore that can't afford those type of things. So affordability is a question. You know, our motto is one that entails plenty of things. Educational components, healthy eating, healthy living components, as well as the opportunity for the community to actually make a change so that it will also give people intangibles like the sense of pride that comes along with ownership. You know, and I haven't had the opportunity to sit in front of folks, so I really want the opportunity to talk with the mayor, folks, different agencies in the city, and I want the support from folks in South Shore. So my question is this: feasibility of it, viability of it. What are your thoughts, if you have any? And if I can, I'd like to collect as many cards as I can. I want to pass a yellow sheet around because I want as many people as possible to read this proposal. It's not the answer. It's not going to save the world. I want it to simply be a starting point where the conversation is inclusive in South Shore. And at this point, it's not.
This is a great question. This is definitely not something I could comment a lot on, but I can definitely connect you with the folks at the Department of Economic Development and Planning at the city. So I'm going to leave a lot of my business cards here. Unfortunately, Trinita and I have to have a meeting at downtown at 1, but I'm leaving a lot of business cards. So if you can email me, I will definitely connect you with the right person at the Department of Planning and Development. And the rest of my business cards are here. I apologize, I do have to run.
Anyone else want to speak to the viability or feasibility of co-ops?
Love the idea.
Are there any other questions from the audience?
Hi, my name is Abel Fernandez. I work for the Puerto Rican Culture Center in Humboldt Park, and this is what I'm working right now. We started last year in a Healthy Bodegas initiative in La Canasta Básica. They're really nice ideas. La Healthy Bodegas is mainly on providing fresh fruits to corner stores. So, and basically we, PRCC, the Culture Center pays for the fruit, whole price, and delivers, and the owner store will sell them at a really low price, and they will keep the profit. That's just in a way that they can have it available for the residents in the community. The other initiative is La Canasta Básica, where members of the community can sign up for and receive amount of pounds every 2 weeks, and they get different type of vegetables. But what's happening is, for those great ideas and initiatives, we struggle to keep up. And that's what my question was going to be for Dr. Choucair. Yeah, I have hard time pronouncing his last name. So, but how? What is there are some great things going on already in the communities. How can the city, in this case, will follow up, will improve the initiatives in order to keep up? Otherwise, we have to stop, and it will start the same problem again. So that was more, yeah.
Could I just ask, when you say you can't keep up, does that mean you can't produce enough produce?
That's one. The other is because I'm the only person working full-time, I would like to have people working part-time, but there's no money to hire people. So there's not enough resources to keep up with these ideas. So how can small organizations will keep up?
One of the things I would say is, let me give you his card, because send him that email and ask him that question, and we've got it as a matter of record as well. But any of the other panel members, maybe some of the resources that you guys have been able to tap in, you could share?
Well, so I would say that it seems like your problem is a basic funding problem, which is a problem all of us face, right? And so currently our the bulk of our general operating funds come from private donors, and I think it is the case that I think as Connie mentioned earlier, that you have to be kind of creative about the types of grants you apply for, because especially now I think a lot of sort of food access grants require that you both do, like, you know, increase physical activity and increase access to fresh fruits and vegetables, which is kind of difficult because typically no one organization does both of those things as part of their mission. And so, I would, and I'm not sure what the answer is. I think I'm really just saying, yes, I understand where you're coming from, and it's a problem we all face, and really the solution is we need money, but, you know, I'm not really sure that, I don't know how deep the city's pockets are for that kind of thing. And so the one, I guess, advice I would have for you is sort of be creative about how you sort of market what you do to funders. And if the grant doesn't seem like an exact fit, there is perhaps a way you could still apply for it and sort of make what you do appropriate to the grant, such that you would also be eligible for funding that it might not have occurred to you that you were eligible for.
Yeah, I would say from a private side, a lot of the times when I talk to my nonprofit partners, what I tell them to do is focus in. And this sounds kind of dumb, but I tell them look for the partners. Here's what I mean. So I had an organization come to me and say, we want you to sponsor our automotive career fair in Detroit. And I said, we're Walgreens. Yeah, but you guys sell motor oil. But that's not the focus of my business. It just happens that I sell motor oil. Now, when the American Heart Association comes to me or Komen for breast cancer cure comes to me and said, I want you to promote a program for free mammograms in underserved communities. Duh. Of course, that totally makes sense. So in your case, if you're looking for food access, look for organizations that are doing just that. Somebody like a Kraft Foods that is interested in access to foods in communities, and that's all they do is hunger. That's all they fund. Mondelez International, same thing. They do two things. They do food access and hunger, and they do healthy initiatives. So go for those organizations that are naturally going to be your partners. It's a little bit more difficult, I agree, when you're a smaller nonprofit organization, but look for the partners either A, particularly just in your community, but B, that are just going to be you're going to be a strike zone for them because you're doing exactly what they're funding.
Are you a nonprofit organization? You are, okay. Because otherwise there are models of peer funding, peer loans, and those are good models for getting something up and going that is very community-centered.
Are there organizations or entities that provide technical assistance for smaller nonprofits that are looking to do some of the work that you may have tapped into to help build your capacity? And this is for the panel members that represent nonprofit organizations.
I can at least think of, it depends what kind of help you need. Like, for example, if you need help with technology, Motorola Solutions does a ton around just helping nonprofits with better access to technology and that sort of thing. AT&T, increasing your broadband access and that sort of thing. That's what I mean when I say target exactly what you're looking for. If I need help with the technology in order to improve my nonprofit, you can go to a Motorola. If you need something like food access and just funding for hunger, maybe I can go to Kraft. And I would also say that I think we're seeing this more and more and more. Go to private partners more than the government sector. Because that, from being in boards of nonprofits, I'm usually getting paid more on time from the private partners than I am from the public partners. Just saying. So get creative when it comes to applying for those grants too.
Marty Castro. I'm chair of the Civil Rights Commission, but I'm answering this question as a member of the Chicago Community Trust Board. I would suggest and encourage you to consider, if you already haven't, applying to the trust. We occasionally put out requests for proposal for various grants, and food security issues are issues that we're involved with. Also, the trust has a Latino philanthropy fund called Nuestro Futuro, which focuses primarily on early childhood, but it also makes grants to Latino serving organizations on capacity building. So perhaps you could apply for one of those grants in the next cycle and then use a grant from the trust to actually leverage grants from some of the corporate sponsors that Rafael mentioned. So afterwards, I'm happy to give you my personal card so we can follow up on that.
Now I'd like to open it up to questions from our State Advisory Committee members. I think we'll be starting with
not so much a question, but I wanted to follow up on the gentleman's question as well. So it sounds to me like you also need bodies, people there to help you do the work. And so I would encourage looking into volunteer opportunities and organizations that can provide you with low cost, bodies that are going to help you do the work. And I work for an organization, Public Allies Chicago, that does just that can provide young people who can come in and help you with your programming, but it doesn't cost what it would cost a full-time staff member to come on. So I think that there are opportunities for you to get people to work with you so that you aren't exhausted trying to do everything yourself. And I can give you a card and we can talk further.
Yes, this is primarily for Rafael. To some degree, politics, policies, ideologies can either promote or restrict business activity in the city of Chicago and elsewhere. I'm thinking particularly of another member of the Wall family, the Walmart fiasco. It was not exactly welcomed into this city, even though they provide low-cost goods, including food. My question, I guess, is what has Walgreens' experience been with the city of Chicago and your initiatives to start these food oases? What is it like to do business in a state that is considered one of the worst states in the country for doing business?
Well, let me take back a second, but to be honest with you, it's our hometown. So it has been, we've been here for, over a decade. So people are aware of us, they know us, they trust us. So it's been a little bit easier than some of our other retail partners to work with the city of Chicago. That being said, that hasn't been the same reception in other states where we've tried to do similar things. It's been a struggle for us to try to educate some of our partners in government that what we're really trying to go after is trying to see Walgreens and our pharmacists as a point of access to healthcare. And something as simple as if I'm able to vaccinate people 18 and under, maybe to the age of 10, I can provide more vaccinations for kids that need a flu shot, a Tdap shot, a tetanus shot. So I'm sure that my government relations counterparts, Donovan Pepper, would have a completely different answer for you. And not to say there has not been any struggles. But I would say that our experience, at least in Chicago, has been one of collaboration with the organization. And to be perfectly honest with you, when we started this project, it was in collaboration with the Daley administration. And it's continued to progress with the Emanuel administration and broaden with that administration into more of a national project. So I would say in Chicago, there's still some struggles, but not as many as in other cities, at least for Walgreens.
Farhan Yunus here. Ms. Spreen, I had a question about experimental station. You said that you folks collect data. Now, obviously, like all the other organizations that we're speaking this afternoon, you collect sales data. Is there any other data that you collect, and how does that information that you gather influence the decisions you folks make?
That's a very good question. Yeah, we are in the process of developing the capacity to, at the 61st Street Farmers Market, so which is where we test everything before we implement it anywhere else, of testing and tracking health data on customers who are willing to participate. So as that unfolds over the next 6 months, I can get back to you on how well that works.
When you say tracking health data, does that mean you have, I've seen, I don't know about the farmers markets, but I know of other community activities and centers, even street fairs, you'll see occasionally physicians who are there and can run very basic tests like, I'll sit here and I'll take your blood pressure, that kind of thing. Does your 61st Street Market have those kind of facilities available? Or
that's what we're going to be implementing, yeah. So beginning with the new market season, that's what we're aiming for, working with the University of Chicago Medicine. And so on a regular basis, their staff will be coming to the market, and we're now calling them community health markets. And it has to do with the ACA and the fact that in order to assist hospitals to partner with farmers markets around the state, it would be very helpful for them to have a way to measure impact. And so this is our attempt to help them, and then we'll also have the information ourselves. We want that kind of measure and that kind of data, so that we can show that, you know, our SNAP customers who come to the market, and we will know how often they come, even though it'll be anonymous. We will know how often they come. We will know over the course of time whether or not their health measures change. And there'll be probably some broad kind of analyses that we can do. But until we have the numbers, I don't know exactly what we'll pull out of them.
Okay, thank you.
But we're working in that direction. Yeah.
Good afternoon, everyone. I'm Peter Nicholson from the Southland Healthcare Forum, and my question is regarding affordability of foods. If you notice, the last couple of weeks, asparagus has been 89 cents a pound, and that's usually $5 to $10 a pound, it depends on where you go. The question is, what if the government stopped funding farmers not to fund and let them produce, and use those monies for other funding? How would that affect the price of food coming to the community, if it would at all?
Can you say if they stop farmers from producing, can you say the first part again?
If the government stopped funding farmers not to farm, not to produce.
Yeah, I mean, it is the case that a lot of people have made the argument we provide subsidies in this country for farming exactly the wrong, unhealthy things. And so, I mean, yeah, you could have a large-scale government policy that would look like subsidies for the farming of produce, or just to not have subsidies for the farming of, say, corn, or something like that. And yeah, I think you would see definite effects, but I'm not sure that, you know, anything we say in this room right now is going to sway anyone to sort of do that. But yeah, I think subsidies play a huge role, and I mean, I think market incentives play a huge role, and so it definitely is the case that if you shift the incentives of producers, you will have an effect where certain foods become suddenly cheaper and other foods become more expensive.
Okay, I'll just add something to that. I think it's important also that the corn, the commodity crop farmers that we have, and that's the 95% of the not the fruits and vegetables, of the crops grown in the state of Illinois are commodity crops, and we grow less than 5% of our own food that we actually consume without it being processed. But it's very important, you know, that the commodity farmers don't know how to grow the kinds of products, the kinds of crops that we would call fruits and vegetables. So there's a big educational component as well. It's not just that there would be incentives, there would have to be a whole educational component that would go along with it to teach them how to do that again, because that is another component of our culture that's been lost.
We have time for 2 more questions. We have one from Betsy Schumann-Moore.
Hi. I believe I read about Christopher Kennedy having an innovative food delivery program in food deserts or underserved areas. Does anybody know about that and what became of it?
Was it
Christopher Kennedy?
Top Box, right? Chris Kennedy's
Yeah, that
project?
sounds right, yeah. Can you explain it, I mean, in a minute?
So, yeah, I think I told maybe David to contact that. I don't know what became of that. So, as far as I last spoke to someone there over a year ago, and as far as I know is that, yes, they launched the initiative, and there are several sites, and I think from what I hear, again, this is all hearsay, so you should, I mean, I take this forward. But from what I understand, their approach now is to work more with schools and do the delivery through CPS schools. Because I think one problem they may also have experienced is an audience, the outreach component, the letting people know, the getting the actual demand for the product. And so I think, as far as I know, they're still working on the initiative. And I think they're trying to work more with like institutions that already have a client base, as it were.
We got one more question here.
Not a question one, but a comment for the gentleman there, my brown brother. I want to say, have you thought about state initiatives that provide subsidized employees? It may be temporary during the summer, but I'll put you in touch. If it's not for profit with 501c3, I'll put you in touch with a colleague who can assist you with subsidized adult employee.
Great. Well, we've run out of time. I'm sorry. If there's additional questions, we'll talk about ways to get those questions into the record. But that concludes today's meeting. I want to thank each of our panel members. I'd like for you to join me in thanking them. And at this point, the State Advisory Committee is going to move into its open meeting, and we will be deciding during this meeting, discussing at this meeting what to do with this information. I'm going to bring Barbara to close this out. Thank you.
Thank you. On behalf of the Illinois Advisory Committee, again, I thank the panel for taking your time, and it was an excellent discussion. And as Mr. Nevels has said, that we will be following up with you again. So thank you, and thank you also for everyone who participated and was in the audience for this discussion as well. And at this time, we're going to be taking a 10-minute break before we get into the meeting of the Advisory Committee. So, thank you.